So let's talk about Peyronie's disease and the treatment options. So what is Peyronie's disease, first of all? Basically, in the normal erection, the chambers that fill up with blood are surrounded by this tough connective tissue called the tunica albuginea, and that tissue stretches out to whatever size you have and then holds the pressure. That's basically how an erection works. Now, Peyronie's disease is the disease of that connective tissue, the tunica albuginea, where basically you get a plaque or scar tissue on part of that tunica albuginea. So what happens is the opposite part, the undiseased part, healthy part, stretches like normal, but the scarred part does not stretch, and so you get a curvature in the direction of the scar. So what can we do about that? There's a long list of options, and they all have their pros and cons. So the most common option is to do nothing, right? This is not a cancer, it's not an infection. It generally stabilizes itself and doesn't get worse. So if the curvature is not so severe and you're able to have intercourse and your partner's not complaining, then you don't have to do anything. That's a totally reasonable option. The next option is to basically use traction. So the concept here is that if you consistently pull on a tissue, that tension will cause the tissue to stretch. The classic example is those gauge earrings that people wear that cause the tissue to stretch over time, or the ladies with the long necks from those necklaces that are pulling on their tissue. So there's a device now called the Restorex device, is the most common one, that basically pulls the penis in a stretched position in the direction opposite of the curvature. Now, this is done obviously without an erection, and that stretch is done for about 30 minutes at a time, once or twice a day, for 3 to 6 months. And that has been shown, if you use it consistently, to have a major improvement in the curvature. The downside of that is it costs over $500 out of pocket. There's no insurance coverage, and it only works if you're really consistent with it, and it's sort of a hard habit to build. But for those people that do use it consistently, most of them do report a significant improvement. So that's sort of the least invasive intervention. Moving up to one slightly more invasive would be the injections. These are the ones that you've probably seen the commercials for, the bent carrot. The company brand name is Xiaflex. The drug itself is just collagenase. Collagenase is an enzyme, which is basically a protein that breaks down the protein collagen. Collagen is a structural protein in scar tissue. So the theory here is that by injecting the collagenase directly into the scar tissue, you break up some of that collagen and get some of that curvature to go away. So the problem with this approach is that it's not just a one and done fix. You have to have multiple rounds of injections, often 6 to 8 injections spread out over the course of several months. And it's almost never a cure. It's usually just a partial improvement. And it's really only about a 30% improvement. So if you're somebody with a 45-degree curvature, you go through this months of injections, and at the end of it, you may end up with, say, a 30-degree curvature, which may be all you need, but for a lot of patients, it's sort of a long run for a short slide. But it is an option. It's not a surgery. It's not completely without risks, but it's relatively low risk, safe. It's been done for many years, so it is a legitimate option. The next options to consider would be surgeries. The simplest surgery is called a penile plication, and that's where we basically make an opening in the skin in the opposite direction of the curvature and place some permanent stitches on that tunica albuginea to basically pull it straight. Now, this has the advantage of being a pretty straightforward procedure, no pun intended. Usually takes about an hour or so, and you get an immediate result. Once you heal from the surgery, things should be near perfectly straight. The downside is, at least theoretically, of penile length loss. Now, what we've seen in practice is most of the length loss has already happened from the Peyronie's disease, and if you measure the penis before and after, there's no real appreciable difference, especially if the curvature is less than, say, 45 degrees. So that is a very reliable option, and patients are generally very happy with that option. They basically, without having a major reconstructive surgery, they get their penis straight again and ready for use. The alternative to that is a penile plaque excision and grafting. And this is where you're sort of getting at the root cause of the problem. You're actually cutting out the plaque and fixing it. Problem is, it's a much more invasive surgery. So the plaque is typically beneath the nerves that run on the top side of the penis. So you have to very delicately lift those nerves up to get to the plaque. Then you cut out the plaque and the penis straightens out to its normal length and straightness, but then you have a hole there. And so then basically you have to patch the hole. There's off-the-shelf products that can be used to basically patch the hole and then close it up, and it's good as new. Downside is that there's more risks associated with that. The biggest one that we worry about is erectile dysfunction. The patch job is usually not as good as the original. So if you already have pretty severe erectile dysfunction requiring full dose Viagra or Cialis, it's likely going to get slightly worse with this type of procedure. So that could be a major issue. There's also some risk of damage to the nerves, obviously, from lifting them up off of the penis. Sometimes people will do this plaque excision and grafting procedure and put a penile implant in at the same time. Now, that's a major surgery to do something like that, and introduces more risks for complications. But it is something where you would get your penis to be pretty much near perfectly straight, back to its original length, and fully hard when you want to use it. Now, there's also the option to do a penile implant without doing any of this plaque excision or so forth, because the penile implant itself can help straighten out the penis, especially if it's cycled over time. But that would only be something to do if you already have pretty severe erectile dysfunction to begin with. So there's a lot of options ranging from absolutely nothing to pretty major surgery. And so you have to figure out what's right for you and your partner, and obviously talk with your urologist about this, going over the options. My only major advice would be, if you are going to undergo a surgery, especially something like a plaque excision and grafting, you want to go to one of the few specialists that does a lot of these every year, not somebody who's doing one or two. So that's a very important key to take home. Now, for the minor things like the Xiaflex, there's a lot of urologists who do that, and that's something that I wouldn't say you have to fly somewhere to go to see the person who does the most. That's not that complicated. But if you are going to have one of these major complex procedures, you do want to see somebody who's doing a lot of them, because there are higher risks of complications. So if you're somebody with Peyronie's disease, schedule an appointment with your urologist and talk about all of these options.